Hello everyone, I'm back. So I spoke about neck pain and upper cross syndrome yesterday, and seems like a lot of people had a lot of interest and they could relate to some of the things I said. And it's very common because these days we all use gadgets all the time. Phone is the maximum that we use with social media, networking, texting, everything, and laptops and watching TV and playing video games. So it really, everyone at any age has similar issues because of the lifestyle these days, and we are just not as active, we are not working out as much, and we are in a prolonged posture for too long. So I mentioned upper cross syndrome. That's just one reason why somebody could have neck pain. There are a lot of other reasons why that can give you neck pain. So don't just assume because what I said made sense that you have the same problem. But if you don't have arthritis, if you don't have any major, especially if you're young, in your 20s, 30s, 40s, and you don't have any other real reason for neck issues, like you have never had car accident or you have never hurt your neck, you just slowly started waking up with stiff neck, and you realize that as you spend more time in the office or at school sitting and studying, reading, using gadgets, you have been getting this. More than likely you might have upper cross syndrome, and that's why I'm talking so much about it. But there are multiple other reasons, and that is why you need to see a professional. If you have had neck pain for more than 3 to 4 weeks and it's not gone away, more than likely it's not going to go away on its own because it's been long enough. And if it's actually getting worse, definitely go seek help and go see a doctor or a physical therapist who can give you an evaluation and kind of tell you how to take care of it. So upper cross syndrome, as I mentioned yesterday, is tightness in the front of your neck and upper back, and tightness in the back of your neck and front of your chest, and weakness and stretched out muscle in the front of your neck and upper back. So it's crisscross basically, and that can be treated by, of course, if you think about it, if you strengthen this area and your upper back, and if you stretch out your back of the neck and your chest area, front of your shoulder, that should fix the problem. And a lot of times when somebody has had just started getting neck pain, it can actually very quickly take care of their pain, and then we can keep strengthening them so they don't regress back before we discharge them. And once we discharge patient, we give them some kind of home program so they can continue to do those exercises at home and stay strong so they're not regressing back. And of course, the good idea would be not to sit in slouch posture for too many hours. If you work in a place where you have to sit constantly, office jobs, dentist, I forgot to mention dentist yesterday, but I personally know lots of dentists who have upper cross syndrome, who have neck issues and weak upper back, and they use their arms to do the procedure. And so I also forgot to mention yesterday that shoulder strength is really crucial in preventing neck pain. So if your shoulders are weak, if your arms are weak, your wrists are weak, if you're carrying, lifting heavy, anything all day long, if you're cooking, cleaning, you are overusing your neck, your upper trap area, because your arms cannot handle that strain, and that can make you more prone to neck tightness and stiffness and pain. So the ideal treatment would be making sure you strengthen your periscapular region, you strengthen your shoulders, elbows, and wrist, along with strengthening your neck. So don't just keep strengthening your neck and forget about everything else, because it's a chain. Everything is connected. So if you don't strengthen the whole chain, more than likely you'll feel better while you're getting the treatment, but as soon as you get discharged and you go back to your actual lifestyle, you're going to regress back to your old patterns, and that's basically going in circles. So make sure you're strengthening correctly, you're stretching the tight areas, and stay active. Also, in a job where you're sitting for long hours, make sure every 2 hours you take a break, you get up, walk around, get back, come back to your desk, do some stretches. And I would not recommend stretches on this video right now, because there could be I haven't examined each one of you, and I would not want to give you wrong advice. So finding somebody nearby, or maybe a personal consult, and then I can recommend few things, would be advisable if you have been dealing with neck pain for more than 3 to 4 weeks. And sometimes it's just simple getting started, and you can start seeing difference, especially if it is not a chronic pain. And if it's a chronic pain, don't prolong it anymore. So as I said, strengthen the whole chain and do the appropriate stretching. Now, if somebody has tingling, numbness, and burning along with neck pain and stiffness, now that's a different story, because now you have your nerves which are on fire, and they're upset and they're not happy. They're basically really angry, and once the nerves are angry, they don't calm down that easily. So you have to be careful on what's an appropriate strength training for that person, because somebody who doesn't have these nerve symptoms can start strengthening a lot easily without frequently aggravating their symptoms, versus somebody who has nerve irritation. So then we have to be extra careful training that person. So if you have those symptoms, you definitely need a professional to guide you on how to safely strengthen yourself, so you don't flare up those nerves. And then, because once you flare them up even more, now we are talking about getting cortisone injection and more stronger painkillers. So I hope this gives you better insight into how postural problems can lead to certain neck issues and symptoms in your arms, but then how weak arms are leading you to some of the neck and postural issues too. So it's all connected. Neck can create problems for the arms can create problems for the neck. So the whole chain needs to be strong and balanced. And once you get better, you have to do, but you don't change your lifestyle, you still have to do regular exercises as maintenance. So that way you're making sure you're not staying in this slouch posture, you're not creating the same weakness that you started with, because then there's no point strengthening to begin with. And it's like brushing your teeth. If you brush your teeth every day, that's how you keep your oral hygiene, and that's how you avoid cavities. So if you're going to eat, you're going to brush. So if you're going to sit and use your gadgets all day long frequently, you need to exercise to make sure your muscles can fight gravity, to stay upright in a good posture and be able to use gadgets properly. Another point I would add, especially for people who work at a desk or even dentist, make sure you adjust the table height and chair height according to your own height. I guess I'll have to do a different video for that with some tips, because that's just a lot of information in one video. But make sure your table height and chair height is properly adjusted, so you're not putting yourself in a posture that's actually promoting dysfunction. Because sometimes the table height could be a very high for a short person, and then their arms are up, and then it just puts them in this short neck posture, and then they start getting issues. Sometimes the table is too low for somebody who is very tall, and then they have to obviously bend down to reach the keyboard or write whatever, and that can put them into this slouch posture, and then that can create a lot of strain on the neck and upper back. So I hope this makes sense to you all, gives you something to think about. And if you realize you have been ignoring your neck pain and health, go for a consultation. A lot of people are afraid to go for consultation because they think, oh, what if they tell me I have cancer? Well, nobody's going to tell you you have cancer. Don't think about the worst thing possible. But they are definitely going to tell you a few things that then you can decide whether you want to go get the treatment or not. But at least be aware and know what you're going through, so that way you can make an informed decision and you're not ignoring your own health. Because a lot of times you just deal with it for 2 years, and then it reaches a point where it's just so painful you can't even sleep more than 2 hours because the pain wakes you up. And then I get patients who tell me I can't sleep on my right side at all because as soon as I lie down on my right side, I get this shooting pain down my arm, and it's a lot more common than you think it is. So don't wait until you reach that point just because it's a simple neck issue. If it hasn't gotten better in more than 3 to 4 weeks, it's not going to get better more than likely without proper professional help. So if you like it, give me a thumbs up, and if you have any comments, I would love to hear your opinion, and I would want to hear if you find this helpful. And as I said in every video, if you want to send me a private message and ask me something, please feel free to do so. Try to do it through Active Body, Active Life, so that way I can kind of stay on top of it and send you an email rather than sending it or reply back to your message rather than sending me a personal message, just so that I have more, I can stay on track. Okay, all right, bye, have a good evening.